Are keen to protect everyone through vaccination. And vaccination is something that's been with us for a very, very long time. You know, it's one of the treatments that we've used for centuries now. And a lot of the diseases that we no longer see, and I always talk about things like smallpox, polio, diphtheria, diseases that people will have heard of, have been eradicated by using vaccination. So this is not a new concept, it's a well-established concept. I think the speed with which this vaccine has been developed sometimes puts that out of context. That it can't be safe if you can make it this quick, but it can be. And actually the vaccine that we are rolling out here in New Zealand is an mRNA vaccine, which is a new type of technology in terms of in the public forum, but actually we've been working with this technology for decades now. So that just reminds us that this isn't something completely new. The side effects of it are similar to most other vaccinations, to be honest. So it's not uncommon to get aches in your muscle and where they injected you. That's really common. And sometimes you can get a fever for the next 24, 48 hours and feel a bit achy. That for us is a reassuring thing as immunologists, because that's what we like to see. We don't like you to experience it, but it tells us that your immune system is recognizing what's in the vaccine and producing the protection that will stop you getting sick from the disease if you're exposed to it in the future.
Mataroria, anything that you wanted to add?
Tautoko ngā kōrero o Anthony, he ngā pātai nui, hea ngā painga, ngā hua, hea ngā āwangawanga hoki. What are the benefits, but also what are the concerns or the risks? And like Anthony said, it is safe, it is effective, and it will save lives. It's not only effective at protecting yourself around catching COVID, but also that protection or kaitiaki of your whānau and of our korea and kaumātua as well. So not only individually, but also for our whānau and for our communities as well, that it can both help reduce the risk of contracting or catching COVID, but also there's emerging evidence of reducing risk of passing it on if you do catch it. But importantly, in how the vaccines were designed, is that it's particularly effective at preventing getting really sick from COVID. So not ending up in hospital and not dying. And that's what the original studies showed. It was at 95% effective at reducing the risk of having symptoms of COVID. And nobody in those studies ended up in hospital or dying from COVID. So that's why we know that it's really effective. And we also know from the studies, since they've been conducted, but also this vaccine's been rolled out internationally across hundreds of millions of people, that it is also safe. As Anthony said, you do have some side effects. I've had the vaccine myself because I really believe in it, and it's important to be able to get vaccinated. I was lucky to be vaccinated as a kaimahi hauora, a health worker. And so I've had my first one, and I had a bit of a muscle ache, very, very small, but I was back to mahi the next day and also back to the gym as well. I didn't feel ngenge, I didn't have a headache. I was pretty good to go actually. And so I've had the first one and I'm due to get my next one next week. So I've seen the rangaho, the research, the studies, and also the number of people that are having it both here, which is over 15,000 now among the border workers and the health workers, but also overseas where other countries have also been having the vaccine rolled out too. So not only is it safe, effective, but it's also looking after yourself, your whānau, and particularly our korea and kaumātua who are at greater risk of the impacts of COVID. Kia ora.